Good afternoon, everyone. I would like to welcome you all to this plenary session of the CU conference. Today we will hear about the SDG 3, health and well-being. After the plenary, we will continue with the panel sessions on SDG 3 and SDG 11. The links for those sessions will appear for you in the chat. It is a pleasure and an honor to introduce the chairperson for this plenary. He holds a PhD in exercise and sports sciences from Manchester Metropolitan University in the UK. He's a full professor at the Physical Education Department here at the UFPR. He has expertise in exercise and sports sciences with emphasis in biomechanics, and has a particular research interest in performance, aging, spinal column, and movement coordination. He was the coordinator of the areas of physical education, physiotherapy, phonoaudiology, and occupational therapy at CAPES from 2011 to 2017. In addition, he was the Vice Dean for Graduate Programs at UFPR from 2017 to 2020. He has published more than 150 peer-reviewed papers, most of them in high-impact publications. His research projects seek to understand the strategies applied in falls experienced by elderly adults and amputees, in addition to the training effect of functionality. Please welcome Professor André Rodaki.
Thank you very much, Anna, for your kind words and this nice presentation. And I want to thank you all for joining us for this event. I hope you have a nice connection, because the themes of this afternoon will be very exciting. And I will have the great pleasure to introduce to you all Dr. Silvia Martins. She is Associate Professor of Epidemiology at Columbia University. He's a psychiatrist and epidemiologist. She's graduated from our university here, UFPR, at medical school in January '98. Then she did her PhD Psychiatry Residency and PhD training at Department of Psychiatry at University of Sao Paulo in Brazil. Then she followed a postdoctoral training period in Drug Dependence Epidemiology at Johns Hopkins University. She is currently the director of the Substance Use Epidemiology Unit of the Department of Epidemiology at Columbia University, Mailman School of Public Health, and of the Policy and Health Initiative on Opioids and Other Substance Interdisciplinary Groups, PHIOS. She is also the co-director of the NIDA T32 Substance Abuse Epidemiology Training Program in the department. She has co-authored more than 220 peer-reviewed epidemiological and substance use articles, from which more than 100 first or senior authors, 80 of them led by her current or former mentees. She has served as a principal investigator of multiple U.S. National Institutes of Health funded grants since 2006. She has received several awards for her research and mentoring, including in 2021, the Interdisciplinary Association of Population Health Science Mentoring Awards. Also, in 2021, she was selected as one of the school's 2021-2023 Tall Leader Scholars, and she received one of the Columbia's 2021 Calderone Health Equity Awards. Her current research focuses on consequences of medical and recreational marijuana laws in the US, the synergistic effects of opioid policies and marijuana policies on opioid-related harm outcomes, the relationship between unemployment, insurance, and substance use disorders, and drug overdoses in Latin America. So please welcome you all, Professor Silvia Martins. Thank you very much for joining us. The word is with you.
Thank you so much, Rodaki. Thank you so much for the invitation, to be here. It's a pleasure. It's the first time I'm giving a presentation in what I would say my alma mater, where I studied where I studied many years ago. I just want to check, are you all seeing my screen?
Yes.
Okay, okay. And oh, let me just do slideshow. Can you see the slide? Can you see everything? Okay.
Yes, yes.
Okay, let me just minimize me. I'm not gonna see you. I'm just gonna minimize so that you can see everything. So today I'm gonna talk about COVID-19 well-being, more specifically focusing on mental health and substance use. So I'll talk first about research done by my research team members on the impact of COVID-19 and anxiety and depression worldwide. Then some interesting research done by my colleagues at UFPR together with PHIOS on alcohol use patterns in Latin America during the ongoing COVID-19 pandemic. Then still on alcohol, show a little bit of work that we've been doing on alcohol, on changes in alcohol sales during COVID-19 here in the US. Then back to a prospective cohort study in Brazil, conducted in Brazil together with colleagues in Brazil on mental health and mild COVID in mild COVID patients, conducted in Sao Paulo. And finally, back to some US research that I've been doing with some of my colleagues on substance use disorder as a risk factor for COVID-19, and then talk a little bit quickly about future directions and answer any needed questions. So this is the first study I'd like to present to you all, and it was led by João Castadelli Maia, who was a NIDA Invest postdoctoral fellow. He's now faculty in Sao Paulo, and in which we did a meta-analysis and meta-regression of the impact of physical distancing measures on depression and anxiety worldwide. So why were we interested in doing that? We did that, we conducted that study really early in the pandemic, like around July of last year. And it is already known that depression and anxiety are the most prevalent mental health disorders worldwide pre-pandemic. And there were like some preliminary studies showing that rates of depression and anxiety would have increased during the early pandemic period. And up until then, there was still like mixed results on whether all the mitigation strategies that people had to implement, not just here in the US and in Brazil, but in other countries in Europe, in Australia and New Zealand, like sheltering in place and other physical distancing measures, could potentially impact and increase depression and anxiety. So we really wanted to check like all the studies that had been done like early in the pandemic to explore whether these mitigation strategies had a lasting impact on national prevalence rates of depression and anxiety. So what did we do? We conducted a meta-analysis of global levels of depression and anxiety during the early months of the COVID pandemic. At the time, we thought it would be like at the only months of the pandemic, but we were wrong. And we looked at the effects of the COVID-19 mitigation strategies on depression and anxiety. So what we did is we did a search of all the studies available at the time that had assessed depression with PHQ-9 and anxiety with GAD-7. And we did also a series of subgroup analysis by region, country, different types of populations, and different types of coverage. And we used like national data on these physical distancing measures, and we compared like previous levels of anxiety and depression and current levels of anxiety or depression post-pandemic to try to investigate what was the impact of these mitigation strategies. So we tried to look for studies that had all of this information, and we did like a series of search strategies in PubMed, Medline, Web of Science, and PsycInfo and other citation bases. So for the purpose of our study, like we included all studies that had these several physical distancing strategies, including school closures, workplace closures, places that canceled public events, that restricted public gatherings, public transportation closures, different levels of stay-at-home requirements, countries that restricted internal movements, and all different sorts of international travel controls that, as you know, like are still up into place as of now. So after filtering all available studies at the time, and there was a really huge amount of studies that came out like early in the pandemic, studying the relationship between COVID-19 and mental health. We ended up like including 67 studies that met our criteria in the meta-analytic models. All of these were studies that were conducted in 2020, and they were collected like ever since like late January, where the first few places started to close up to May 31st. And most of the studies evaluated had data on the people they interviewed for about like 15 days. In total, combining all of these studies, we had data on 226,638 people, with an average of about like 3,300 people in each study. The mean age of people across studies was almost like 34 years. Since the pandemic started in China, most of the studies that we found at the time were based in China. Almost 40% of the studies that we found, and then like almost half of the studies were based in Asia, in other Asian countries. They were comprised by general population samples, healthcare provider samples, student samples, either at school or universities, and a few patient samples, and most were online surveys. And most of them had been peer reviewed at the time. We also include like a few studies that weren't peer reviewed yet, but were available in databases pre-peer review. Yeah. What we found based on this meta-analysis is that the global prevalence of depression right in the initial pandemic months was about 24%, which is relatively high, and of anxiety was also 21%. And all of the rates were higher in all countries included in the study, as compared to similar rates, similar general population or specific population rates pre-pandemic in all the countries that were included in the study. Interestingly, when we did like subgroup analysis, we saw that the rates of depression varied across the world, and were way lower in Asia as compared to Europe and other regions of the world. And again, like interestingly, also like China had the lowest prevalence of depression as compared to other countries, and also the lowest prevalence of anxiety as compared to all other countries. When we did like the meta regression analysis to try to see if there was an association between depression and anxiety with all the restriction measures, our models didn't show any significant association between the implementation of physical distancing measures and depression in any of in the combined pool studies. And when we tried to see if there was an association between anxiety and some of these implementation of physical distancing measures, we were only able to see that closure of public transportation was associated with an increase in anxiety, but there weren't any other significant association between any of the physical distancing measures studied and anxiety levels, at least like in the studies included in our meta-analysis. And so of course, like we know that the COVID-19 pandemic has impacted and is still impacting population mental health worldwide, and it will still be impacting it, and we'll still see like the impact like for years to come. And basically like our main conclusion of the study is that even though we didn't see a relationship between these physical distancing measures and depression and anxiety, is that practitioners, healthcare providers, and countries like should be addressing mental health problems now. So in the past year, this year, and in the near future, because we are going through like an ongoing, and sometimes it seems like never-ending pandemic. We were also interested. We and other researchers were also interested in looking at whether there were changes in substance use during the COVID pandemic. And I'd like to particularly highlight this study conducted by some of my colleagues at Unifesp in Sao Paulo together with PHIOS. And this is the study conducted by Zila Sanchez's group at Unifesp. And Zila was an informal postdoctoral fellow of mine many years ago and a research collaborator. The first author is one of her former postdocs, Juliana Valenti. And they Together with PAHO, they conducted a regional survey on alcohol and COVID-19 also early in the pandemic. And they conducted an anonymous online survey that they developed in 4 different languages, in English, Spanish, Portuguese, and French, and collected data between May 22nd and June 30th of last year. They included all countries in, almost all countries in Latin America, and they asked people 18 years and older who consented and reported that they were in their country and hadn't left their country since March 15, 2020. And they asked several questions in regards to demographic, COVID-19, people's alcohol consumption in 2019, then their alcohol consumption during the pandemic period, and then they also asked them about mental health impacts in the last 14 days prior to the interview. Here you see like the whole countries in Latin America where they had respondents from, and you can clearly see here that Brazil is overrepresented, where they had like almost 3,800 respondents, and some countries they had very few respondents, either smaller countries or depending on their data collection strategy. In their survey, most of the respondents were female. It was evenly distributed among like adults ages 18 to 49, but there were less respondents ages 50 and older and 60 and older. That also might be like because younger adults and adults up to age 50 are way more familiar and have way more access to the internet and online surveys than older adults. And about 40% of the population in their study self-identified as white, 4.2% as Black, and more than half of them as mixed race or unsure. So here in the slide, what I'm showing, like from their report, they gathered information on the prevalence of drinking by sex in 2019 and 2020 by different Latin American subregions. And interestingly enough, so the blue bar represents drinking in 2019, and the red and the orange bars represent drinking in 2020. Interestingly enough, in this particular study, what we see overall is a decrease in reports of drinking after the pandemic started overall in all different regions. And even though like the prevalence of drinking is higher in the Southern Cone as compared like to some of the other regions. Then they also wanted to look at whether there were changes in the frequency of heavy episodic drinking, so people that drink heavily by age group from 2019 to 2020. And to do that, they combined all the responses from all countries. And still also in this case, like there was a mixed pattern. There was a mixed pattern of responses. In some cases. And in different age groups, we see a decrease in heavy episodic drinking right after the pandemic started. But we also see in some subgroups an increase in heavy episodic drinking. And interestingly, about a quarter of the sample across all ages didn't change their drinking patterns at all. So some people like drink to self-medicate, or some people like just drink like to try to relieve stressful situations. And of course, like the impact of COVID-19 was I would say a worldwide stressful situation, like that could be even seen like as a collective traumatic event. But interestingly enough, like some of the people reported no change in their drinking. Then also related to drinking, like in my research group, we were interested in seeing whether there were changes in the trends of alcohol sales here in the US during the early months of the COVID pandemic. And this paper was led by João Casadel Maia, who's also Brazilian and is now back in Brazil and was recently published in Alcohol. So why were we interested in looking specifically at alcohol? Also, because as I mentioned earlier, like we know, and it is known like from prior studies, that alcohol use can increase during periods of high stress and also periods related to social isolation, like in several parts of the world and several parts of the US, like people were told to stay at home if they could do, and some people like were really diminished a lot their contact with their coworkers or their family. And up until then, like the few studies that had come out on the topic, they were still contradictory. Some studies had shown like an increase in alcohol use here in the US, an increase in alcohol use in Europe, but other studies showed a decrease in alcohol use after the beginning of the pandemic in Australia and in Latin America. And we also thought it would be interesting to differentiate like whether there were changes in alcohol use on premise. So like if people were still going to restaurants and bars in particular, like for example, I would say that the COVID-19 response here in the US was really a patchwork. There were places where like restaurants and bars were closed for months, like here in New York. On the other hand, there were places like in the Midwest or in the South where things never closed at all, and they just kept acting as if as if they were living in the pre-pandemic world. And we wanted to really see if there was we wanted to really differentiate like whether there were changes in alcohol use patterns, like in people going to bars and restaurants, or if there was like a change or an increase in household consumption of alcohol. So what we did in this particular study, like we used data from retail store sales as a proxy for household consumption to try to investigate increases in alcohol use during the COVID pandemic. So we use data from the monthly retail trade survey, which is a representative sample of retail sales here in the US. And as I said earlier, we use our retail alcohol sales as a proxy for at-home consumption. Our exposure period of time, like we gathered data from retail alcohol sales ever since early 1992 up until September 2020, divided in monthly quarters. And after descriptive analysis, where we calculated annual variation in monthly sales, we ran a series of multivariable Poisson restricted cubic spline models to see if we could identify any changes. This figure, I know it's hard to absorb this figure in just a few minutes. It's a heat map showing the annual differences in monthly beer, wine, and liquor sales across time, ever since 1992 to 2020. And I'd like you just to focus like on this part of the heat map, where we see a huge change in the annual monthly sales. So, and when we put this on a graph, what we see here like is that the orange line represents like beer, wine, and liquor sales that are a proxy for at-home consumption of alcohol, and the blue line represent whether people are going to restaurants and bars to consume alcohol, to consume alcohol. And what we see like is this big change in the period like from March onwards. So what we saw like a significant increase in retail alcohol sales during the early pandemic months, so from March to June 2020. And at the same time, like when we compare to food and drinking place sales, they decreased a lot during the same time period. And we're now planning to conduct more work to extend this work like to 2021 data, and also try to gather similar data in other countries. So now moving a little bit to a primary data collection study. So together with colleagues in Brazil, I was involved in a project in which we gather data on depression, anxiety, and PTSD symptoms among people that had mild COVID in Brazil, more specifically in São Caetano do Sul, close to Sao Paulo. So what we really wanted to look in this study was whether there was a relationship between COVID-19 and mental health post-infection. And we wanted to look at the association between COVID-19 symptoms and post-infection depressive anxiety and post-traumatic stress symptoms among people that had a COVID diagnosis. So what did we do? We conducted a prospective cohort study in São Caetano do Sul, which is like in the metropolitan region of Sao Paulo city. And we were lucky to have research collaborators in the medical school there. And so we had access to information from patients that were 18 years of age and older who had tested positive for COVID-19 and had a mild case. That is, they weren't people that needed to go to the hospital because of COVID. So they were all people that were seen like in outpatient settings. So what we did is like we followed up these patients up to 14 days after their initial diagnosis. And after initial questionnaire, and we asked them about like anxiety symptoms, depressive symptoms, and PTSD symptoms, besides asking them about demographics and also their COVID-19 symptoms. We were able to collect data on almost 900 participants. Almost all of them were female, so 60% or more than 60% of them were female, more than 50% of them were married, and they had education up to, about 60% of them had education up to high school. In our sample, like we were really concerned like that we were really concerned that we could differentiate like people that had previous anxiety and depressive symptoms or had a previous diagnosis of anxiety and depression, that that we would analyze them differently from people that had never had these symptoms. So about 20% of our sample disclosed that they had a psychiatric diagnosis in their lifetime. Since they were all people with mild COVID, they reported about like around four COVID-19 related symptoms. The most common were loss of smell, coughing, headaches, and fatigue. When we asked them about depressive anxiety and PTSD symptoms, almost a little bit more than a quarter of them had depressive symptoms, almost a quarter of them had anxiety symptoms, and 17% of them reported PTSD symptoms. We then ran several regression models in which we wanted to look at the association between COVID-19 and these psychiatric symptoms. So we had like the total number of COVID symptoms, and we tested for their association with either depression, anxiety, or PTSD. And here I'm showing you like the results from our model 1, in which we adjusted for prior diagnosis of psychiatric disorders and other confounders, particularly demographic confounders, and then also model 2, which is adjusted for current psychiatric treatment, so people could have been in treatment, and other confounders. And what we see here is an association between number of COVID-19 symptoms and depression, anxiety, and PTSD. So our conclusion was that exposure to a higher number of COVID-19 symptoms, at least among people that have had mild COVID, may be associated with depressive anxiety and PTSD symptoms. And it is possible also that the social context of this disease, so the fact that people had to also self-isolate and quarantine and be really isolated from others, could contribute to the increases, at least a temporary increase in psychiatric symptoms. And we were calling like for really the need for early mental health intervention among this population, particularly now like since the pandemic is ongoing, and we would really like to either follow up this sample or do follow up research like with other similar samples. And that is something that we're waiting to see if we get funding to do so. Now going back like to US data, I'd like to show you some of the work that I'm doing with colleagues here at Columbia, in which we are looking at the relationship between COVID-19 and substance use disorders in adults here in the USA in the Veterans Affairs population. And this is part of the work in which I'm a co-investigator that Dr. Deborah Hassan is a principal investigator of this project. So why focus on substance use and COVID? So as mentioned earlier, and as I showed to you, like in some of the studies that I showed earlier, there is a lot of research ongoing on how pandemic stress, fear, and isolation has affected mental health and substance use overall and in certain different subgroups. But up until now, there is really little research on the effects of substance use or substance use disorders on risks for COVID-19 infection and among people that were infected with COVID-19 and COVID-19 outcomes. So you can ask me, like, why would substance use disorders affect the risk for COVID-19 infection or the prognosis among people with COVID-19? Well, first we know that among people with substance use disorders, there might be like some biological effects on the immune, respiratory, and cardiovascular systems. Also, people with substance use disorders have commonly comorbid medical conditions that could potentially increase the risk for poor COVID-19 outcomes. Also, people with substance use disorders usually have like some type of psychosocial correlates. They might be involved like in risky behavior. So for example, group socializing instead of taking into account like social distancing recommendations. They might be more risk takers than other people. Also, it is known, like from research conducted here and in other countries, that several people with substance use disorders do not seek treatment when they need healthcare, particularly like in countries where there isn't like public universal healthcare. So it is reasonable to hypothesize that people with substance use disorders could potentially have an increased risk for COVID-19 infection and potentially poor outcomes. So to study these hypotheses, we really need like really large samples that have information on COVID-19 and also on pre-existing substance use disorders and pre-existing medical conditions. Because like COVID-19 infections and outcomes may be rare in the general population, we really need like large-scale electronic medical record data. And that's what this study is perfect for it, because the Federal Health Administration is responsible for providing healthcare services to all eligible US military veterans. And it is the largest integrated healthcare network in the US, with about like 1,255 healthcare facilities across the 50 US states and the District of Columbia. It serves about like 6 million people a year, and it has electronic medical records with ICD-10 diagnosis, prescription and treatments that we can gather information on. So it is a big data opportunity to study this type of health issues. So for our specific study, we use data from the 2019 VA EHR database and data from the 2020 VA COVID-19 shared data resource. So we had data on all veterans that had at least one healthcare visit in 2019 and that were not in palliative care. And we gathered like predictor variables from 2019. So on substance use disorders, including cannabis, cocaine, opioids, stimulants, sedatives. We had information on the demographic data on and several medical conditions, including cardiovascular disease, respiratory conditions, kidney conditions, diabetes. And then we looked at outcomes. So whether people were tested for COVID, like by October of last year, and whether they had a positive COVID test by October of last year. And then among people that had a COVID diagnosis, we looked at the outcomes such as hospitalization due to COVID, whether they were in the intensive care unit due to COVID, whether they had to be put on a ventilator, or whether they died. So we did like an adjusted logistic regression models adjusted for several demographic covariates, and for several demographic covariates, and now like showing the results here among all patients. So we had almost data from almost 6 million patients in the VA system, and what we see is that about 1.1% of men in the system had a COVID-19 positive diagnosis, and 1.26% of women in the system had a COVID-19 diagnosis. And of course, like since this is a sample of veterans, we have way more men than women in this particular sample. Then when we did analysis specifically among people that had a COVID-19 diagnosis by age, and interestingly and as expected, we see that there were more people that had a positive COVID diagnosis among those like ages 35 to 49 and those ages 50 to 64. Interestingly, in this sample, different from general population samples, we see less, the proportion of people among those older is slightly lower than among the middle-aged populations. We also examined what was the proportion of people with COVID-19 by different racial ethnic groups here in the US, and we saw that diagnoses of COVID-19 were more prevalent among the Latino subpopulation and among the non-Hispanic Black subpopulation. So to summarize, when we look overall, like the COVID-19 positive diagnosis in the veteran affairs population were somewhat similar to general population sex, age, and race ethnicity trends that we see similar like in the general population here in the US. But I didn't show you like the detailed logistic regression graphs due to timing, but we also saw that VA veteran patients with a diagnosis of substance use disorder had a 25% greater odds of being COVID positive than other patients, than people that didn't have a substance use disorder diagnosis, and that this relationship was strongest for people that had cocaine, stimulant, and opioid use disorders. But this relationship ended up being a little bit attenuated when we controlled for demographic characteristics and medical conditions. And just a quick summary about like the hospitalization outcomes among those people that were COVID-19 positive. So people that had a prior diagnosis of substance use disorder had an increased odds of being hospitalized for COVID as compared to people without a substance use disorder. They also had a 27% greater odds of being admitted in an intensive care unit, particularly those like with cocaine use disorders and opioid use disorders. But we didn't see any relationship between like a prior diagnosis of substance use disorder and having to be put in a ventilator once you are in an intensive care unit. And we also didn't see a strong significant relationship with death. Actually, we saw an attenuated risk of death among people with a substance use disorder after adjusting for demographics and several of the other chronic conditions. I know I presented on a lot of data. I just like to talk just 1 quick minute about like work that our research team is doing, but that I didn't have the data yet to be able to present here. We also have, like in another project in which I am the principal investigator, we have a supplement in which we are studying COVID-19 and opioid-related harm outcomes, including opioid use disorder and opioid overdoses among chronic pain patients in the state of New York. And we hope to have like findings. We hope to have findings to report early next year. We also have funding to look at the effects of unemployment insurance here in the United States and opioid-related harm and overdoses, as well as psychological distress post-COVID here in the US. And we're, as of now, like gathering all the data to start doing analysis now in December. We also, together with one of my former mentees that is at Penn Medicine in Philadelphia, we just requested funds to conduct a smaller online study to study vaccine hesitancy, which is, as you probably have seen in the news, which is a big problem in this country, mental health in people that use drugs, both in New York City, Philadelphia, and in Northern Florida. We're also waiting to see if we get funds for a machine learning project, which would be a larger big data project in which we would use like US national COVID data and COVID-19 mitigation and economic policies data. That was just reviewed at NIH yesterday, so I still don't know what's the outcome. And also together with colleagues in Brazil, particularly in Sao Paulo, at University of Sao Paulo, Unifesp, INSPER, and Faculdade de Medicina do ABC, and also colleagues in France, we're waiting to hear whether we will get funding for a potential transnational project in which we would look both at big data or prospective cohort data in Brazil, in the US, and in France. But we have to wait until January and February to see if we will receive funding. We will receive funding for that. I'd like to acknowledge all my research collaborators, including students, staff, postdocs, and faculty, not just here at Columbia, but also at Unifesp in Sao Paulo, at University of Sao Paulo in Sao Paulo, Faculdade de Medicina do ABC in Sao Paulo, and then particularly for people that collected the data for the prospective cohort study at the Universidade de São Caetano do Sul. Without them, we wouldn't have been able to have data on mild COVID patients in Brazil. And I'd like to thank you for listening. Obrigada.
Okay, Silvia, thank you. Thank you very, very much for this nice talk. If you have people, some questions, you can just put them on the chat and Silvia will be available to access them. But I do have my own questions for you, Silvia. Mm-hmm. First of all, thank you very much and congratulations for this outstanding work. I was curious about if you have a measures of the, talking about alcohol consumption, of those who had COVID, if their alcohol consumption increased after that.
So I can tell you, I didn't have time to add to this presentation. Maybe I should have. Like in that prospective cohort study that we conducted in São Caetano do Sul, we also have a separate study in which we looked at alcohol consumption and other drug use. And other drug use, but we didn't find any significant change in that particular sample. But of course, like it's a particular sample of 900 people with mild COVID, and we didn't see any change at all. There are other studies that I'm aware of conducted here in the US, for example, like in samples of college kids, or general population samples where people see increases in alcohol consumption, where people see increases in binge drinking. So for example, one of my former master's students had access to data from college kids in all colleges in Missouri, and she analyzed data on the early months of the pandemic, but we haven't published this yet. She analyzed data on them in Missouri, and she saw an increase in use among those kids in the initial months. But I should also say, like, this is a population where we know that binge drinking and heavy drinking is usually higher than in the rest of the general population.
And I have an additional question on top of your answer, because is it related to the income of the family? Because in Brazil, we have several families, they're low income. And I don't know, I'm assuming they must have increased much more the consumption of alcohol in comparison to those families of high income. Do you have any, insights on it?
We haven't looked at this specifically, but I would say, of course, like just like in Brazil, like I would say, even though there are more young adults in college here in the US than in Brazil as compared to the general young adult population. Of course, like people that are from higher SES usually have more additional money and can spend that money on alcohol and can spend that money on alcohol and drugs. So that is something that we plan to do, and that is something that also, like, there are other colleagues of mine, so led by Lark and Mac Reynolds, they conducted an online survey of, and it's an interesting online survey that they started during the pandemic. They conducted an online survey on community colleges, which in the US, like, are the colleges that usually serve the lower SES population. And their result, I don't think they have as of now, like, their results in regards to alcohol, but I know they're analyzing the data and the results should be coming up soon. Should be coming up soon, but they have like a sample of, I think, 25 to 30 community colleges. So more than, I would say, I think it's more than 10,000 college students that were interviewed, and they have the data. It's just that they haven't analyzed it and it's not yet available. But yes, there will be, there most likely will be a relationship.
Yeah, it's a very, very interesting point, especially because if you think in terms of our young adults and people entering faculties, where, as just you said, they have some money on the pocket, so alcohol consumption would be a concern. I'll have another question from a friend, Professor André Duarte, here from our university, and he's asking: are there any studies evaluating post-traumatic effects concerning people who suffered from long COVID disease?
Yes, there are people doing that. I think even there is a group at University of Sao Paulo that is doing that. They have a sample of about, I think, 600 people where they are evaluating that. But yes, there are several groups doing that, not just in Brazil and in the US, but there are several people that are experts on PTSD that are doing that. And I think the only country that has a really nice structure and that is following up people with long COVID and that has a really good database is the UK, as far as I'm aware. So what I mentioned, like in our last slide, like the transnational project, we're trying to get funds to potentially do that, to follow people with long COVID and then not just look at PTSD, but all other outcomes. But we're still waiting to see if we're gonna get funding. But I know the people that are doing that, the people that have like the largest database, they are in the UK.
Excellent. People, if we have any further questions, we might have additional time for one question if we wish to ask and to use this opportunity to ask anything related to this presentation. Meanwhile, I just want to remind everyone, when people they're writing their questions, I want to remind you all guys that we have right after this session at 3 o'clock, one of the presentations of Professor Rainer Schwarting from Marburg University, Pleasures, Pains, and Brains. That will be very, very exciting. And after that, we're going to also have a talk of Professor Wojciech Czocko-Zajko with the title of Developing a Sustainable USA Nation Strategy for Promoting Physical Activity and Health Lifestyle Choices. And the very end of the day, about 5 o'clock here local time, we're going to have Professor Emily Murphy and Eloise Elliott from West Virginia University in the US talking about coronary artery risk detection. Okay, guys, if you have any other further questions, I would like to thank very much Professor Silvia Martins for her nice talk. And we hope to see you around here in Brazil as you graduate in our university here. And it's always a pleasure to see you around. So please, when you come back here, come back to visit us. If you have any time, I'm pretty sure Curitiba will have about the same weather as New York at the moment. And we will enjoy your presence here and your expertise with us.
Thank you. Thank you so much. Anna, please, sorry.
No, please continue.
No, I'm just saying thank you. Yeah, I plan to go to Curitiba after the holidays, but it will be really quick. It will be, I haven't been there like for 3 years now due to the pandemic. Yeah.
So I would just like to thank you all. Thank you very much, Professor Silvia and Professor Hodaki.